guys, welcome back to Medical Coding with Blue. Today's episode is considering a new career as a medical coder. These are my frequently asked questions, so these are all your answers. So let's go ahead and get started. I am Blue. I'm a medical coder. If you are just joining me, I hope this video will help you with your questions. Please like it, give it a thumbs up. I hope you'll subscribe. And if it helps you at the end, I hope you'll share it with your friends or anybody else who's interested in becoming a medical coder. So I have been a medical coder for over 10 years. I have lots of experience and I've pretty much been there, got a t-shirt. Been there, done that. So let's go ahead and get started. So my number one question is, I want to be a medical coder. Where do I start? Okay, there are two major medical coding associations. If you are looking to seriously be a medical coder, these are one of the two you have to get a credential through, okay? The American Health Information Management Association is long-standing, is steeped in history, and then you have AAPC, which is the American Academy of Professional Coders. Now, both of these websites I will leave down in the description box below, along with my contact information, so if you have any more questions, you can let me know. The AAPC, or the American Academy of Professional Coders, has a large grassroots, wonderful network of medical coders as well. Both associations have their positives and things that make them so great. You will have to go to each website and compare the two. There are many differences between the two, particularly when it comes to their testing and their credentialing. So you'll have to see which one you feel is best. If you are still confused about which credential to look at, look in your area and see what medical coding credentials they're asking for. Now, before, I should give you a little warning before, okay? So the warning is this. You will see a lot of listings for medical coders that are requiring additional experience, or they want years of experience before you can even begin. Now, if you are considering a career as a medical coder, that's something that you have to know. Medical coding is one of those really weird professions where they want you to have experience before they hire you. But how are you supposed to get experience if no one will hire you? Clearly, all of us were able to get in at one point or another. So you have to be ready once you get credentialed to face that daunting task of finding a job. It is possible. It may take some time, but it is possible. There is that you can go through temporary agencies to find a job. You can make job connections here and there. And sometimes you can get lucky and they do hire brand new coders with no experience. I've looked on many job listings for research for my show, and I've seen where we accept brand new coders with no experience. So there are jobs out there for new coders with no experience. You just have to know where to look. Okay, so that aside, if that's where if you want to get started, that's the place to look. The second thing to say is, what school do I go to? Well, you're in luck because both associations have online medical coding programs, okay? The thing about AHIMA, though, the American Health Information Management Association, they're ramping up their program online. I went blank for a second. They're ramping it up right now, so they're just working on it. It is not available to sign up for currently, and today is April the 16th? 17th. Yes, today's the 17th. It's April 17th, 2020. And they are working on their website, so it may be a little while. You may have to call the customer service hotline if you're interested in going with them. AAPC has lots of sales. You'll see that as soon as you go to the website. They are right up front about all their sales, or they're right up front with how can we help you. There's a little thing that pops up every time. I've gone to AAPC website several times. I'm credentialed through AHIMA, so the only reason that I go to the AAPC website is to do research for my show, as far as like getting contact information for them. But there's plenty of information on that website as well. So you can go to either one. They both have online medical coding programs. And that way it's clearly directly through the associations themselves. It is a fraction of the cost of going to a traditional trade school, which, by the way, not that all trade schools are bad, okay, but I'm just going to say something. Let's just be honest here, okay? We've all heard horror stories about trade schools. There's no guarantee on the instruction that you're going to get at a trade school either, because you may have a teacher, but it may not be a teacher that is teaching you critical thinking. There's a difference between a teacher that is up there proctoring from a book versus a teacher that is actively trying to get you to think and to know where to find your resources and things like that. That gets missed so much in the beginning, which is part of the other reason why I do my show, is because I want to take what I know and share it with you all. And so I do this because I know that a lot of us learn independently. And I know that a lot of us, would really wish we had somebody to turn to. And sometimes it's difficult. If you're working in an area where maybe people are not as experienced as you are, and it's hard because you're like, I need to ask somebody, but no one here knows. Who can I ask? This is why I have my show. So I have lots of episodes where I'm answering questions about coding. So I hope you'll take the time to go through the episodes as well. But yes, so if you're interested, you can go through either association, go through their online program. Again, it's a fraction of the cost. If you're not sure and you're thinking maybe you want to go to college, of course, is wonderful. I mean, it's great to get higher learning, of course. But the thing about college is it's way more expensive. Now, you need to know if you really like it first. I mean, at least that's my opinion. If you're going to spend a lot of money, at least know that you're going to enjoy it, okay? Some people get their degrees in health information management and they absolutely do not like it. And some people get it and they love it. It's the best thing in the world to them. So it's going to be up to you. But to me, if you're going to learn, I would learn the cheapest possible way and get in and then decide if you want to further your education more. Sometimes you can get lucky and your employer will pay for you to be continually educated. So it's entirely up to you. That's just my opinion on that one. Okay. The next thing is I've been getting lots of emails from people who are asking, can they work for an American company and live abroad? Okay. That they want to do remote coding from abroad. Here's the thing. Every company is different and every remote coding company is different. And some have rules that you have to be within a certain radius of the head campus so that you can, either telecommute, or you can be available for meetings and things like that. And some would rather you be in the US for security reasons. There's a myriad of factors that go into it. If you are looking to do that, I would ask the company beforehand, okay? But here's the other deal. If you're a brand new medical coder, the chances of you getting a remote coding job right out of the gate is slim to none. The reason that I say this is because I'm not trying to burst your bubble, and I would never, ever, ever, ever try to discourage anybody from doing the things that they want to do. I'm telling you the truth. I'm telling you what I know as somebody who's been in the industry long enough to know. And I have no dog in this fight. I have no reason to encourage or discourage you, okay? A recruiter may tell you, oh yes, you can work at home. But what they don't tell you is that you need years of experience before you can start working at home. The reason that you need all of this experience is because medical coding, when you learn it in school versus being out in the real world, is two different things. Yes, the codes, it's the same idea, but there's different rules for different insurance companies. That's number one. Then different facilities, whether it is public, private, or government, they all have different rules for how they do things, okay? They have site-specific rules for how they do things, okay? And then there's just the doctors, the nurse practitioners, the PAs, everybody that documents. You have to be able to look at their documentation, and everybody's going to do it differently unless you really work with them and sort of get them all on a standard template, which again, It's going to depend on the provider themselves, because some providers like to use unapproved abbreviations for things. Not every abbreviation means the same thing, okay? And then you have some providers that will give you lots of documentation, and you have some that will give you very little documentation. So it all depends on where you are and what's going on. So there's just all those ifs. And I'm not telling you guys this stuff to overwhelm you. I'm telling you this so that you know. Okay, again, I have no dog in the fight to say yay or nay or discourage or encourage. I'm just telling you guys the truth, because I'm a straight shooter. That's the thing. I don't sugarcoat anything. If you want to know the truth, this is it. I'm just saying. All right, moving on. Age. That's another frequently asked question. Hey, Blue, I'm 29. Is it too late for me to change careers? Hey, Blue, I'm 35. Can I change careers? I'm 45. Can I change careers? I'm 56. I'm looking to do this. Can I change careers? You absolutely can do anything that you want to do. Okay, that's number one. Number two, you have to be willing to say, okay, this is going to be difficult for me to get in, but I'm not going to give up, and I'm going to keep doing it because this is what I want to do. You have to be able to think that and know that and say that and believe it. Think, know, believe, receive. Okay, you got to be able to do all that. And I knew a lady when I went to school. She was in her 60s. She was 61. She got her medical coding credential at age 61. She is still a medical coder today, and she survived the ICD-10 changeover. We went from ICD-9 to ICD-10. So, and she's in her 70s. So if she can do it, I'm just saying, okay? Yes, you can absolutely do it. And if you've never had a job or worked outside of the home and you decide to study medical coding and you want to get into it, you are welcome to do it too, because it's open to everybody. All you need to get credentialed is a high school diploma or a GED. You do not need any kind of degrees. You do not need any kind of medical background. It is open to everybody. Okay? So I'm just saying, you got to study and get your credential, and then you can move on and go on and go forth. But yes, that is a big thing, and I get asked that a lot. And I get asked questions from nurses as well. Nurses, sometimes they want to make the changeover from being so hands-on with a patient to still being in the healthcare industry, but maybe not so hands-on with patients. We have zero contact with patients, period. Unless you're doing the billing side, which coders can be billers and coders, but it's often two different people because it is two separate functions. You have the biller who deals with the insurance company, and then you have the coder who deals with the staff, okay? The doctors and nurses and everything else. So two separate things, okay? But again, it could be the same person, all right? So sometimes nurses want to be medical coders because they still want to use their knowledge and still be in the healthcare field. What's great about nurses or LVNs or medical assistants who want to be medical coders is that you already have a working knowledge of what a record looks like, okay? Which makes you far steps ahead of a standard medical coder who's coming in off the street with no experience in medical, okay? I started with no experience in medical, okay? When you have a nurse who wants to be a medical coder, they often will have them become the clinical documentation improvement people, okay? If they don't get that credential right away, they will have them start working towards that. Sometimes if the staff knows that person used to be a nurse, they're in the perfect position because they know and they understand what is missing here, versus a lay coder who would be coming in and they would have to really dive deep and sort of try to ask a lot of questions and try to figure it out before they realize, hey, there's something that's missing here, okay? And a nurse can see that right away. And so that's why nurses get sort of put into that kind of position. So it is a great field for nurses if you want to be still in the healthcare industry and you want to use your knowledge. This is a great transition over from active nursing to being a medical coder. Maybe you don't want to be on your feet all day. Maybe you don't want to interact with patients anymore. And there's many reasons why people don't want to interact with patients. Sometimes it's just, it burdens the heart. The nurses care, and it's just hard for them because, their heart goes out to these patients, and it just gets to be a lot. And it's understandable. I mean, you get involved, you're caring for them. So, but yes, nurses can absolutely do medical coding. Okay, now on to the next one. Males. I like this question because I've gotten this question a lot lately. Can males be medical coders? Yes, we need more men in the health information management field because of the simple fact that we are dominated. This field is dominated by women. Period. Point blank. Period. We dominate the field. Men are in the minority. Okay, but yes, you can. If you're a male, you absolutely can be a medical coder. Just know that you're probably going to be the only male in the hen house most of the time. Okay, so if not, then you'll be in a leadership position or something. Not to say that all men are going to be in leadership positions. I'm just saying that usually the only males that are around that I know two. There's two only in our department, and one is a supervisor and one is a regular coder. So, it just really does depend. The one that's a supervisor, he's got a higher credential than the other one, so that could have something to do with it. But yes, if you're really serious about becoming a medical coder and you're a male, this field is also for you. Okay. But yeah, that's one of those really big questions that I get a lot. And then the other one is, can I do this part-time to start? I want to change careers, but I want to still have my main job, but I want to do this on the side. Can I do that? Nope. And if you're trying to do it, I'm telling you now, you're wasting your time, because the thing is, medical coding takes everything. It takes your brain, it takes your energy, it takes your time. It takes time to learn it. And especially if you have no experience right out of the gate, there is a slim to zero chance that you are going to get a part-time job as a medical coder. It does not happen. All the listings are for full-time medical coders. Okay? And for us that are veterans and we've been around, sure, we can get part-time work because we already know what we're doing. Again, it goes back to having some experience. The reason that they want you to have experience is because they don't want to have to sit there and have to help you. They want you to already know what to do. We get paid very well. And that's one thing I don't do is talk specifics about dollar amounts on my channel because everywhere in the U.S. is a different amount. And some people don't like when I say that. No, I'm sorry. There's nothing I can do about that. But I'm just telling y'all, there are so many factors into why salaries start out at different rates, okay? If you're curious, go to the Department of Labor or the Bureau of Statistics and look in your area, in your zip code, so that way you can find out what they're paying in your area. Because again, somebody who's living in California is going to make a different amount from somebody living up in Michigan. Or somebody living down in Florida is going to make a whole lot different than somebody working up in Nebraska. Completely different economies and areas and everything like that. So that's just another thing. But yeah, don't look into this field if you're looking to do it on the side. I've had somebody who said, I'm a court reporter. I want to do medical coding in between cases. Nope, can't do it. You have to be in a secure area. We work with private information. So when we work with private information, you can't just be out willy-nilly going anywhere. And it's the same if you're working at home after you've gotten experience and you start to work at home. You have to be in a secure area. You can't just be in the living room and everybody's in the living room and they can see your computer screen. It doesn't matter if they don't know. It doesn't matter if you have kids and then they're grown and they know better than to look at your computer screen. Doesn't matter. It has to be secure. Because you don't know what information is going to pop up on your screen. And you don't know if it's going to be somebody that maybe you know or maybe somebody else in your household knows. Okay, this is why this stuff has to be secure. When we are working in facilities, everything is secure. We are in areas where we have to have badge access, that nobody can go back there because we have that information. Okay. Another question I get is, I have a criminal history background. Can I still get into medical coding? We all know that just because you have a criminal history, it doesn't mean that you're automatically counted out. You have to be honest about when it was adjudicated. You have to be honest about what the nature of your crime was. There's a difference between somebody that did something when they were a kid, like steal a car, versus, somebody that, does identity theft. Okay. There's a huge difference there. And if obviously we have access to secret information, that's not going to make you look good if you've had that before with the identity theft stuff. I'm just saying, if you do illicit, drugs, again, it's not going to be a field for you. We work in the health information field. So no, you're not going to be welcomed if you do drugs into the hospital. It's not going to happen. You will be drug tested. That's another question that I get a lot. Yeah, you will be drug tested. I've been drug tested quite a few times. And it's just because it's a standard practice. It's a standard practice before you get hired. It's a standard practice even when you're working. Sometimes people say, okay, surprise drug screen, pee in a cup. Okay, I got nothing to hide. Okay. But yeah, that's just one of those things. And sometimes when people don't get told those things and it's too late by the time they get their credential, and it's just like, oh, I can't get a job. Why? Because they something either come up on their criminal background check, or they pop positive on a drug screen. It's just one of those things. You have to be aware of what you are signing up for. Okay. This is a field for intellectuals, okay, for thinkers. This is what this field is all about. And it is a wonderful field. It has done so much for me in my own life. I enjoy it, but I am a nerd. That's just me, but yes. So that is a lot of the questions that I get. I'm trying to think if there's anything else that I need to touch on. But yes, that's pretty much all. You don't have to have a background in medical, just so you know. I didn't have a background in medical. Because some people will ask me if they need to have like prior anatomy and things like that. No, but you'll learn it when you're in school. Another question I get is there math? There is no math in medical coding. Medical coding is not the same as computer coding, like computer coding where they're making web pages and stuff and software and stuff. That's something completely different. That is not us. We work completely different, okay? We are on the medical side. What we do is we look at documentation all day and turn that documentation into codes for diagnoses and procedures and anything else that was done or issued during this visit. And we do this for the insurance company for statistical purposes, lots of data collection for different reasons. Okay, so there's a myriad of reasons why we do what we do, but that is what we do. We look at documentation all day and we're reading all day. And somebody asked me, do you sit all day? I don't personally sit all day because I'm usually running around. When I am working at the hospital currently, because of the pandemic, I am working at home, but normally I am not sitting down all day. I am very active with my providers, but that is just me. Not all facilities are the same. Not all coders are created equally. So not all coders are going to do the same things like I do. I go above and beyond trying to be there for a good support for my providers and for everybody else that supports the provider. Okay, so that's what I do. And because of that, I'm always running around. It depends. Obviously, you can be very smart if you have a job that's where you're sitting all day, but it's going to take research on your part as well, and to be responsible about like what you're eating and taking a break and, not staring at the screen and making sure you're giving yourself breaks. Okay. Just to sort of refocus your eyes and things like that. So Yes. And then one last question. What are the hours? Guys, it's going to be different wherever you go. I mean, obviously, everybody starts their days at a different hour. I personally work from 6 to 2:30. This is not a normal schedule, but because of my facility, they do allow it. And they allow us to stagger in. So we are the first ones up from 6 to 2:30. And I've been on that schedule for over 10 years. So I really like it. But I've had some where I worked Sunday through Thursday. I've done the extended schedules where I'm working for 10 or 12 hours a day. I don't enjoy that, but some facilities do allow it. It just depends on where you're working. You have to ask them. Okay. So, did this help you guys? Did I answer your question? Because if I did, yay! I hope this gave you some more direction and some clarity onto, what is next, what comes next when it comes to changing careers. A lot of people are asking because of the pandemic, what did they do? But hopefully, like I said, this answered your question. If it helped you, I hope you'll share it. I hope you give it a thumbs up. If you want to see more, I am a medical coder, obviously, and I do lots of exercises on my Patreon channel, so I hope you'll consider supporting me there. I will leave my link down in the description box below, and I will go ahead and wrap this one up. But if you are a medical coder, a medical coding student, somebody curious about the fascinating world of medical coding, a provider or a nurse, I invite you to like and subscribe and follow me on my journey in medical coding. I will see y'all next time. Bye!